Hello, and I hope everyone is having a great day today. My name is Reverend Hightower. I am the Executive Director for Antioch Urban Ministries, otherwise known as AUMI. AUMI is a nonprofit organization that has a 501c3 located here in Atlanta, Georgia. AUMI provides housing services for men and women who are HIV positive and or living with AIDS. We also provide housing for men and women suffering from substance abuse issues and challenges. Additionally, we have a youth mentoring program for boys and girls between the ages of 7 to 17. One of the additional programs that was added a couple of years ago is called Serving Our Seniors for individuals 55 plus. We are awesomely proud of what our food and clothing bank has done over the last year and a half, especially during the pandemic. The food bank served more than 1,000 individuals at any given time from March of last year until actually February of this year. But today, we're here for another very special reason. Many of you may know, and many of you may not, that May is recognized as Mental Health Awareness Month. Mm-hmm. Having that being the forefront of what this conversation will be about, we're excited to be able to share and get some great information and knowledge from one, Dr. Brenda Edwards. As I stated before, May being Mental Health Awareness, we wanted to talk to Dr. Edwards and have a conversation about mental health. Dr. Brenda Edwards is a counselor educator, a psychotherapist who believes in the expression, pay it forward. Sounds familiar? Her passion in teaching and counseling provides an avenue for her to be able to engage both personally and professionally experiences to help others on their path to healing and recovery. Relating back to what I mentioned earlier, the area of recovery for so many different things. She owns an established private practice providing professional consultation and counseling services. She specializes in addiction counseling and enjoys supporting and empowering women in recovery. I think that's very, very important that we emphasize women in recovery, empowerment. Dr. Edwards holds a doctorate in education, a state license as a professional counselor, certifications as a master addiction counselor, and a national certification as a certified addiction counselor level 2. That's a mouthful. But all in all, also, she is like one of my best friends, and I am so glad that we had an opportunity to interview and share conversations about mental health and what it looks like, or what it is, how to look at self-care, and how to approach the stigmas associated with the term mental health. I had previously asked Dr. Edwards to look at some of the questions ahead of time. The first one I had was, what is or how would you define mental health?
First, let me thank you for the introduction. In terms of defining mental health, what I've found helpful is to be careful not to impose my definition of mental health on others.
Okay.
My definition of mental health, of course, is grounded or shaped by education that I've received, what I've learned, the research, things like that. So if I'm in front of a person who may be challenged with mental health issues, I have to be careful not to perceive that how I understand it, that's how they experience it. So what happens is I've learned to pull back. Tell me what it is that you believe your challenge is. How do you feel what you feel? What do you think is going on with you? Let that person define what the challenge is. But going back to mental health, the terminology, mental health is a good thing. I think what happens sometimes we get mental health confused with mental illness, and they're two different things.
Okay.
Mental health, we want to strive for. Mental illness, we want to treat. Does that answer your question?
It actually does. It kind of leads into the very next question, which is, what is the difference between mental health and mental illness? And I think you started going into some of that definition. But I think one thing that I found very interesting in your explanation of mental health is it really boils down to one simple process. That's listening.
Exactly.
If you're not listening, you're going to miss it. Or I like the word you use. You impose your terminology or your value or what you interpret it to be on someone else.
And then you end up trying to treat it from that way, which is not going to be effective.
Wow.
And then we have to pay attention to who it is, like who it is that's saying I'm hurting. Whether it's a man, whether it's a female, black person, white person, because we are all unique in how we experience mental illness,
Okay.
but we're also unique in how we experience mental health, the good thing. So,
Okay.
in order to understand a person's experience of mental illness
Mhm.
and then recovery to mental health from their shoes, like you said, you first have to listen to the story. You know the story first, and don't put your definitions on what they're experiencing. The word depression and words rather depression and anxiety are kind of bounced around a lot. You know, almost everything gets lumped into what anxiety is and depression. And if we're not careful, we come to believe it looks the same no matter who has the experience of anxiety or depression. I was counseling a gentleman the other day, and I said the word depression, and I could tell by his body language he didn't like that word. He prefers sadness, and which is different than depression. It really is. But to say someone is depressed, there's a stigma associated with it. A man, you're not supposed to be depressed because you're supposed to be stronger than that. You're supposed to be able to man up. So there's no depression. I feel sad, but I'm not depressed. He automatically got defensive.
Wow.
But that was my fault. And that's how I learned is I need to know how he defines what he's experienced. Tell me what you're experiencing, where you feel it in your body, and how it shows up in your life.
Okay.
That way they give you a starting point and you can move from there to understanding how they experience the illness and then what is it that you think would change that for you, meaning they define their path to recovery as well.
That is so interesting because I'm sitting here like biting at the bit, right? Because I'm such a person, I like interrupting sometimes, and I'm trying so hard not to.
Okay.
And I'm finding that when I don't do that, I get the answer that I was going to ask.
Exactly.
Okay?
That's so active listening.
Exactly.
Okay.
And I think often we get that mixed up. And with your definitions of what I'm seeing and even examples, it helps me. It helps us to better understand how we look at mental health.
Right.
And it's not always what we think it is.
Right.
And you mentioned males, for instance. I think with Afrocentric males, there's even more of a stigma when it comes to certain wordologies, like depression, because that's a stigma possibly of being soft.
Exactly.
Goes back to what you were are weak, which is so far from the truth. Right. So your example is really an excellent way to look at this process. And moving forward, once a person has identified, and even if I'm just at home and I'm feeling a certain kind of way, can you identify how methods to increase self-care and how the awareness relates to mental health? How important self-care is as it relates to mental health?
Again, unique, individualized. You know, like for me, self-care, and it has a lot to do with resources. Okay. I think sometimes we might tell people you need to do self-care. Well, the resources I have to do self-care may be different than the resources you have. For me, self-care is catching a flight and getting out of Atlanta. Everybody can't afford to catch a flight and get out of Atlanta. So that means I need to be considerate and mindful what resources this person has to be able to take care of themselves. The way I like to do that is tell me, a little bit about how your day goes. Okay. What are some of the things you do from the time you get up until the time you go to bed? That way you can look into a person's routine and possibly pick up gaps here and there. But it gives you an idea of what resources that they have that you can probably highlight for them. What did you think that maybe if you took a little 10-minute shower in between or a 10-minute bath, that's a form of self-care. And that may be the only resource that person has, but it's still self-care. What do you think about just stepping outside and breathing for 5 minutes? That's self-care. Okay. Outdoor air has been shown to operate almost like an antidepressant. Oh, wow. And people don't know that. So self-care is get out and walk around your house. Okay. If you don't have resources to go anywhere, you can still take care of yourself. So again, it's listening to how the person is currently living and helping them to find avenues within that without stressing them with having to go buy something or spend money in order to say this is self-care. Wow, that's deep. And it's interesting because I kind of relate that to how this session began. I told you I just need a minute because I need to breathe. Right. And so to me, that was my self-care. Right. That didn't really cost a whole lot. Exactly. But a few minutes of my time to kind of
recapitulate, if you would, before getting into this process.
Exactly.
And I think it's important also the way that you define that it's individualized,
It is.
because everybody's circumstances are different. And so often in life, we try to meet up to the Joneses, and that's so not necessary. Is that about accurate?
I don't know if it's tried to meet up to the Joneses. I get that, but I think it's the way we've been socialized that if I'm not doing this, then I'm not okay.
Okay.
If I'm not doing what the television says I should be doing, or social media, all these Facebook, and if I'm not living the way it looks like these people are living, then I'm not okay. And I think we're being socialized to believe it has to be a certain way for me to be taking care of myself, or has to be a certain way for me to be mental healthily. That's what I think it is. Is that we are socialized not the best way all the time.
And do you think also some of it is from birth, or based on your culture and how you were brought up, you can be made to feel like certain things have to be done a certain way in order for you to do self-care? You have to go out of town to be on vacation, which is so not true. You can be on vacation at home. I liked what you mentioned, maybe even taking a walk or something somewhere. That doesn't cost you anything.
Exactly.
But if you tell me I need to do self-care, and that means I got to go to Florida, but I got to walk around my complex money, then it's okay. I shouldn't feel bad about what I have to do.
I agree. Yeah, sometimes how we call it family of origins. The family we were born into kind of shapes and influences how we even see mental health and mental illness as well. So a lot of factors come into play in how we end up defining it from our own shoes. So anytime you're in a position as a helping professional to help someone, try to hear their story. That's the best way you can get into their shoes as much as possible, to try to understand it from their shoes, but not help them from your shoes.
Gotcha. Let it be their issue.
Okay. They're the expert of the problem, not you.
Because they came to you for
that.
Exactly.
Okay. But let them be that expert by telling you what the problem is. Let them tell you the context or the environment in which it's happening. And in that, they get to hear themselves talk. You get to hear, and you being an objective listener can possibly highlight some gaps in there somewhere that could be built on. One thing we want to avoid is pathologizing people. And what I mean by that, we just focus on the problem. Tell me about a time when you don't feel this way. What's your life like then? You want to pull in those times as well when things are going good, so you can come from a strengths-based perspective.
Gotcha.
Yeah. We don't want to zone in on the problem. Oh, you need to do this, you need to do that. No. That's why we want to get a full picture of what their day is like, because there has to be some good times or not so bad times in there. Let's talk about those times. What are happening? Tell me about what's happening when you don't feel as bad. What are you doing? Does that make sense?
It does. And I totally get that. And so the way that you can increase self-care is to not always look at what's going wrong, but look at what did go right today.
Absolutely.
And then look at what went right yesterday.
Exactly.
And don't beat yourself up so often.
Right.
Okay. The other one that we had, there was I think it's an interesting discussion. It's what can be done to reduce the stigmas associated with mental health. And I'm going to add a caveat to that, especially in the African American community. Okay, because for people of color, there's always been this thing. Oh, if you go into the psychologist or psychiatrist, you got to be what? Crazy.
Right.
And so I just wanted to talk about for just a few minutes about what your thoughts were on how can we reduce that stigma, and then especially for the African American community as a whole. And I don't want to make it a color thing, but it really is, because it's been stigmatized for so long that if we don't look at it, especially this month and throughout the rest of this year, that we may not ever get better in it.
Great thoughts. Well, this is one way of doing it, of course. So thank you for that, is sharing information from a different perspective. Education, of course, anytime we can position ourselves to educate our community, not just on what mental illness is or a mental health is. There's a track record that supports the stigma. If you consider what happened, like with the Tuskegee experiments and things like that, that validates the need to fear the mental health system or to fear providers,
Mm-hmm.
that they don't always have your best interest, and that, you know, that's valid even now.
Right.
You know, if you do the research, you know, there are a lot of negative outcomes. Like I've been reading about when a black female seeks gynecological care, it's different. They don't get the full spectrum of care as their counterpart of a different race all the time. So it's still present. So there's some validation to the stigma that you got a right to kind of be scared of mental health providers. So, but that's where the education comes in, to try to educate to the extent possible. But again, don't penalize for them having that thought that if I go, I'm going to be crazy. Well, tell me what might happen if you don't go.
Right.
You know what I'm saying?
Now, what you just said is really important, because so often we do penalize.
Right.
Hey, what's wrong with you? You must be.
Right.
So you're right. Reverse that.
Right.
And I like that thought, you know, instead of saying, well, why do you feel like that? What's going to happen if you don't go?
Exactly. Let's talk about what our path is going to be like if we don't get the help.
Wow.
And take it from that perspective.
Right. And I think it's also, if you don't mind, it takes conversations like we are two brown, black people having conversations, and we're going to air this so people can understand that we're coming from a different perspective.
Right.
I'm asking questions to help myself, but also to help my constituents and to help other people like me. So I appreciate your definitions and how to look at this mental health aspect. And I just want to close with, do you have any other thoughts that you'd like to share for that person out there who's wondering, what do I do, or how do I go about getting help? And then I can close with some ways that people can seek some assistance help.
That's a great question. Depends on who the person is and
That's
where that person is.
I got you.
Because, you know, if you really think about it, there's some areas that are very rural, and it's not as much accessibility to resources. Now, the virtual thing is a big thing, but then there's still barriers that some people don't have insurance. So, you know.
Internet access.
Right. You know, so I think in terms of where do I go, if I'm thinking, placing myself in that person's shoe who has no insurance, who's hurting, wants some help, I'm going to go to my nearest emergency room and talk to somebody.
Gotcha.
You know, because there are some community-based free resources, like Grady Hospital has a great array of services available for low-income people who don't have insurance coverage. I would start there. Medical, like if I do have a primary care physician, because some people that don't have, you know, the what I call commercial forms of insurance, like Blue Cross, things like that. So they might have Medicaid or something like that. I would start with my primary care doctor. Let my primary care doctor know what's going on with me. I think there may be a perspective sometimes that that person is there only for my physical health, like if I'm dealing with diabetes, high blood pressure, but there's no disconnect. It shouldn't be from the physical self and the mental self. They're connected. So that person, if don't have the training, they know somebody who does. They can connect you to that person. So start with your primary care doctor. What hospitals are in your area? Call them. You know, do you all have any services for people who don't have much money or who don't have insurance? And they probably know who does. So it just takes reaching out. Another thing, since you said Black, our African American community, there's a lot of heavy reliance on spirituality and religion. So the church definitely is a great place, because we were kind of socialized to rely on religion and spirituality growing up, remember? So I think that's a great place to start as well.
And thank you. And I'm glad you kind of close with that, because you're right. When we take it back to the beginning, if you would, the church is always that beginning foundation for a number of different entities. And then from the church, there are different offsprings that have been developed, like Antioch Urban Ministries, for instance. That could be a resource for that person seeking some type of help, because we do have professionals that are available to redirect, like yourself and others. And having said that, we want to conclude today with, if you are looking for some assistance outside of what Dr. Edwards has already provided to us, I want to provide you with a couple of hotlines that you can contact. I'd like just to share those practices and referrals with you now. The Georgia Crisis Hotline, 1-800-715-4225. You have the DeKalb Crisis Center. SAMHSA has a hotline for substance abuse, and we have the Battered Women Hotline. And what we will be doing is at the end of this session, we're going to have all of these numbers available for you so that you can retain them and use them for whatever purpose you might need in the near future. And you can always reach out to our Antioch Urban Ministries, 404-524-9775, for any additional referrals that we're not covering today. Today is impossible for us to cover the whole gamut. I just want to personally thank Dr. Edwards for your time, your passion, and your participation in this conversation. And this conversation is one of many that we'll be doing with Antioch Urban Ministries with other professors like Dr. Edwards, and I've got some others that we'll be talking to. And this is what we're going to be doing in the community to let you know that help is there. You just have sometimes just let people know you need help. And as a result of that, Antioch Urban Ministries has many ways that you can help us help others. All right. And our website is one of those. That's www.antiochurban.org. You can go to our Facebook page. We also have an Instagram page. We got a YouTube page. Those are different resources you can go to. And I don't ask Dr. Edwards if she wants to make her information available for anyone who may be seeking counseling for any reason. If you're receiving clients at this time, she can give us that information. We'll have it on the end of our program at the end of the service.
Okay.
So we also have ways that you can help donate to help somebody get the help that they need through Facebook again, through Givelify and PayPal. Just know that we are here to help as much as we possibly can. Again, Dr. Edwards, thank you so much for your time.
Thank you.
And I know how valuable time is. And with that, I'm going to conclude and say, you guys, you'll have a great rest of your day. See you next time.